So Dr. Cady, thank you for taking the time with me.
Delighted.
I'm excited to understand how you got started in surgery.
Well, I actually went to medical school to be a psychiatrist because I was a psych major at college, and I went to medical school because you couldn't treat people with a PhD at that point. So I went to medical school, but that rapidly changed after I had my first rotations in surgery and psychiatry and so on. So I got turned on to surgery, and then I was at Cornell, and then I came up to City Hospital on the tough service, and Gardner Childs was the chief. He was he was a great figure, wonderful surgeon. And when I went off to the Navy and came back, and I switched to the Harvard service at Boston City Hospital, and then I went off to Memorial Hospital, partly because the options for further expertise were either, at that point, either vascular or cancer, and that was before the official surgical oncology thing. So I went off to Memorial Hospital because I didn't feel I really was accomplished enough to go out and be thrust out in the world. So I went to Memorial Hospital, and one of the people there that was most interesting was Randy Tollefson, who was one of the thyroid surgeons, and the head and neck service was very nice to me. And but Tollefson had an interesting session with the residents, and he brought in two stacks of records, one on this side and one on this side, and he said, which pile belongs to patients that had total thyroidectomy? And of course, because they had all sorts of complications and so on. And Memorial, the Center of Ultra-Radical Surgery, had this little spot in it where they were very conservative with thyroid surgery. And while I was there was a young, the surgeons used to go off in the community, and sort of traveling surgeons. And one of the surgeons there had been to a hospital in New Jersey, and he told me about this. He was helped a local surgeon operate on a 19-year-old woman about 2 weeks before her wedding. And they did a total thyroidectomy, bilateral radical neck dissection, and she got all sorts of complications. And it didn't fit with me. When I left Memorial, and there were a lot of experiences at Memorial, which were great experience, great training, I was given a position at Lay Clinic, and my mentor there was Neil Sedgwick. When Neil finally retired, he had done about 5,000 thyroids.
Wow.
And people don't realize, but the big private clinics were all founded in thyroid disease. Mayo, Leahy, Corral Clinic, Cleveland Clinic. And it was these places where patients could actually, with Graves' disease, could get an operation and not die as a result of surgery. So they're all founded, and there are tremendous numbers of thyroid cases that came through. And as a result, the Lay Clinic files had huge numbers of cancers too. Yeah. And Neil, there was another resident at the time. I was in the junior staff, and Neil gave him the job of looking up the thyroid cancers, and he bogged down. So they finally turned it over to me, and so I had this access to this database of over 1,000 patients with thyroid cancer. So we did a bunch of papers with that. And then I worked with Neil Sedgwick. We published some textbooks of thyroid and parathyroid surgery, and wrote articles about the steps to take during parathyroid surgery, to step 1, 2, 3, you know. And but I published a lot of stuff on the basis of this enormous database dating back from 1930.
Yeah.
And it was great fun. I used to use key sort cards. You know what key sort cards are?
I do.
So I did all my early research on key sort with a knitting needle and so on. And some of the stuff, just the beginning of the computer era, and getting a computer program was so cumbersome because it was very awkward. You book somebody, you'd tell them what kind of questions to draw up and so on. And they'd go off for a week or two. By the time they came back, you'd forgotten what the questions were. So I went back to key sort cards, which you could control. So we did a number of papers, and then later on we one of the remarkable things, my chief at the academic service was Bill McDermott. And it turned out Bill McDermott had published a thyroid cancer paper back in the 40s, in which he noted the break at mid-40s between high risk and low risk. And of course, Cryle was coming along at this time, Barney Cryle, the son. And he was talking about thyroid cancer and so on. So we eventually came up with the Ames criteria.
Yeah.
After Mayo had published the ages, age, grade, and so on, and grade was sort of a nebulous. So we came up with the Ames criteria and worked that out over iterations over time, as you know. But it was, to me, it was interesting because you could clinically define with pretty clear, rudimentary features people that would have a 99%, 98, 99%, 20-year survival. So it was, I'm a surgical oncologist, maybe more than a surgical endocrinologist, because I came along at an earlier time. But, so it was, from a cancer point of view, it was fascinating to come into a group of young people who, in every other cancer, the younger you are, the worse the outcome.
Yeah.
But in thyroid cancer, it's this unique disease. And it occupied, I mean, probably 80 to 90% of the patients fit into this group. So I was interested in that.